Welcome to Pixarize's video on G6PD Deficiency, the most common human enzyme deficiency. Being a common enzyme deficiency, test takers love to use G6PD deficiency because of its many tie-ins to biochemistry, pharmacology, and pathology. Let me give you a visual way to remember all the details so you can tackle any question about G6PD deficiency on test day. We'll start our scene on this fancy G6 plane. You know, the G6 that rich people ride and rappers always talk about? By the way, this G6 plane will also be our symbol for G6PD, since the enzyme G6PD literally starts with G6, and plane starts with the letter P. What's more, there's definitely something wrong about this G6 plane. It appears part of the plane has blown open. In other words, this G6 is deficient. All the better since a deficient G6 anchors us to G6PD deficiency. So what is G6PD anyways? Well, G6PD stands for glucose-6-phosphate dehydrogenase, an important enzyme in many biochemical reactions. G6PD plays a crucial role in the pentose phosphate pathway, or HMP shunt. When this G6PD enzyme is deficient, it results in a clinical syndrome known as G6PD deficiency. Simple, right? Alright, now let's meet our unlucky traveler. He kinda looks like Samuel L. Jackson. You know, the actor from that airplane movie, right? Our traveler here should remind you that G6PD deficiency mainly affects Africans and African Americans. In fact, G6PD deficiency can be seen in about 10% of African American males. We'll get to why men are more affected in just a moment. Apart from African Americans, there are also other mutations that can be seen in people of Asian and Mediterranean descent, but the most common test vignette will give you an African American male. Now, this traveler looks terrified about the hole in the plane. So terrified that he's holding tightly onto his cross necklace. By the way, a small cross is our recurring symbol for X-linked recessive inheritance, since a cross is X-shaped, right? And this is here because G6PD deficiency is inherited in a, you guessed it, X-linked recessive pattern. As you know, X-linked recessive inheritance means that this disease primarily affects male patients. Inheritance and epidemiology are actually important, as seeing an African American male patient in a vignette can be an early clue that you're dealing with G6PD deficiency. So what happens as a result of G6PD deficiency? Well, look no further than that lit nicotinic pipe on the wall. Yep, this is one of those no smoking in planes signs. Since this G6 plane serves a special clientele, they're more worried about pipe smoking than plain old cigarettes. But wait, isn't a nicotinic pipe our recurring symbol for NADP, with the nicotine representing nicotinamide in NAD and pipe representing the P? And this pipe is lit, representing that this is NADPH, since NADPH is the high-energy form of NADP. Putting this together, this sign prohibiting lit nicotinic pipes should help you remember that NADPH levels are low. There's no lit pipes here, since smoking is prohibited, right? One of the direct results of G6PD deficiency is a decrease in NADPH levels. As for why NADPH levels are decreased, recall that G6PD plays a key role in the pentose phosphate pathway. This pathway serves many roles, but one of them is generating NADPH. So when G6PD is deficient, the pentose phosphate pathway slows down, and there is accordingly a fall in NADPH levels. This has other downstream effects, which we'll cover in just a moment. Now, this is no ordinary airline. This G6 plane even has people dressed as geishas serving as flight attendants. You know, these fancy Asian airlines always go overboard with the service. Anyways, this geisha is here to remind you of GSH, otherwise known as glutathione. Get it? Geisha for GSH? And what's more, when the G6 plane blew open, this geisha fell to the floor, which helps me remember decreased GSH levels. One of the downstream consequences of G6PD deficiency and decreased NADPH is a decrease in GSH or glutathione levels. GSH is a very important antioxidant, which means that it runs around scavenging oxygen-derived free radicals. So when GSH levels are decreased, there's a higher chance of oxidative damage. As you can expect, when this G6 plane blew open, the cabin lost pressure. And in these situations, oxygen masks drop down to deal with the difficulty breathing, right? By the way, this oxygen-related stress should help you remember oxidative stress. You know, because needing oxygen when a plane bursts open seems pretty stressful. All of this should help you remember that patients with G6PD deficiency have increased susceptibility to oxidative stress. Wait, what? What does this oxidative stress even mean? Well, recall how most tissues in our bodies use oxygen to respire. One of the byproducts of oxidative respiration is the production of reactive oxygen species, which are basically free radical compounds that go around wreaking havoc. Luckily, many of us have antioxidants like glutathione that scavenge these offending agents, keeping the oxidative damage in check. However, remember how I just said that patients with G6PD deficiency have low glutathione levels? This means that one of their main antioxidants is gone. Obviously, this leads to increased oxidative damage, which can lead to eventual cell death. So that's the pathophysiology of G6PD deficiency. But what actually happens to cells under increased oxidative stress? Well, let's just take a look at that red life vest in our geisha's hand to find out. Now, I don't know about you, but that inflatable red vest kind of reminds me of a red blood cell. But this vest is ripping due to the sudden depressurization in the cabin. Kind of looks like a broken red blood cell now. This ripping blood-like vest should remind you of hemolysis, or the rupture of RBCs. You see, one of the main clinical effects of all this oxidative stress is hemolysis. RBCs are particularly susceptible to oxidative damage for two reasons. One, the job of RBCs is to run around carrying oxygen, which means they are naturally exposed to more reactive oxygen species. Two, mature RBCs lack mitochondria, the organelle that normally processes this oxygen to deal with it. As such, antioxidants like glutathione are critical for protecting red blood cells from oxidative damage. So in G6PD deficiency, this lack of GSH becomes crippling to RBCs, leading to widespread hemolysis. Test writers will tell you that there is hemolysis by giving you decreased red blood cell counts, increased LDH levels, decreased haptoglobin, and in a patient with fatigue and dark urine. Now, one very high-yield point I should mention is that hemolysis is not constant in G6PD deficiency, but rather episodic. In fact, patients are asymptomatic most of the time, since other antioxidants exist, which deal with oxidative stress at normal loads. However, during periods of increased oxidative stress, the other antioxidants get overwhelmed, resulting in hemolysis. Let's talk about what these oxidative stressors are, shall we? Look at the outside of the G6 plane. It looks a little rusty, right? No wonder why the plane blew open. It must have been in really poor shape. Let's talk more about this rust while we're here. Since rust is a kind of oxidation, this rust kind of reminds me of oxidizing agents. Obviously, we're only talking about oxidizing agents since these can cause hemolysis in G6PD. Specific oxidizing agents include foods like fava beans, as well as drugs like the sulfonamides, nitrofurantoin, malarial drugs, and anti-TB drugs. I hate memorizing random lists, so here's a memory trick. I just think of this as fava beans and antimicrobial drugs. If you see a patient develop hemolysis after eating fava beans or taking these drugs, think G6PD deficiency. So, taking oxidative things causes oxidative stress. Tell me something I don't know, Sherlock. Okay. Why don't you just guess another cause of oxidative stress? Do you get it now? Seems like this geisha does. She's definitely sick with that mask over her face. This sick mask is here to remind you of infection. All of this is here to help you remember that infection is another cause of oxidative stress in G6PD deficiency. Before we finish up this video, it is important to talk a little about some high-yield findings that can be seen on blood smears of patients that are G6PD deficient. Let's turn to the food served on this G6 plane. Check out all that ketchup on that guy's burger. It's even fancy Heinz ketchup. This Heinz ketchup bottle should remind you of the Heinz bodies that are seen on blood smear in patients with G6PD deficiency. Heinz bodies are these inclusion bodies seen in red blood cells, and they are basically just collections of denatured or misfolded hemoglobin. These appear in G6PD deficiency since oxidative stress can denature hemoglobin. Now what about that burger? It looks like our unlucky passenger was only able to take one bite. This bitten burger should remind you of bite cells. Bite cells, also called degmacytes, can be seen on blood smear in patients with G6PD deficiency. These cells are red blood cells that literally look like a bite was taken out of them, created by the removal of Heinz bodies by splenic macrophages. Together, a blood smear of Heinz bodies or bite cells can point you towards the diagnosis of G6PD deficiency. Finally, let's touch on one interesting point on why these mutations might have developed in the first place. Check out the original cause of this explosion. It seems that someone took an aerosol mosquito spray onto the jet. This mosquito spray has exploded, causing the predicament that we're in now. By the way, this anti-mosquito spray should help you remember the anti-malarial effect of G6PD deficiency. Yes, you heard me right. A deficiency of G6PD is actually protective against some forms of malaria by reducing the risk and severity of infection. The exact mechanism is not well understood, but since malaria is a parasite that replicates in red blood cells, it is thought that G6PD deficiency and the resultant increased oxidative stress creates a hostile environment for the parasite to live in. It is thought that the prevalence of disease in people of Asian, Mediterranean, and especially African descent corresponds with areas in which malaria is endemic, and that having G6PD deficiency might have conferred a selective advantage through its anti-malarial effects. Pretty interesting, right? Whew, you did it! You learned everything you need to know about G6PD deficiency. Let's quickly summarize G6PD deficiency so you can take a well-deserved study break. G6PD, or glucose-6-phosphate dehydrogenase deficiency, is the most common enzyme deficiency in humans. The disease is commonly seen in African Americans, and it primarily affects males due to its X-linked recessive inheritance pattern. A deficiency of G6PD stops the pentose phosphate pathway from producing NADPH, resulting in decreased levels of NADPH. This decreased NADPH, in turn, causes decreased glutathione or GSH levels. Decreased GSH levels make these patients susceptible to oxidative stress, which presents in patients as episodic hemolysis after exposure to oxidizing agents or infections. Blood smears can reveal Heinz bodies and bite cells. Lastly, G6PD deficiency can give some resistance against malaria infections. Alright, now we're actually done here. I know this was a lot, but G6PD deficiency is a very high-yield topic for testing. I actually think we covered all the facts pretty nicely. I'll see you in the next one.